May is Stroke Awareness Month, and we are on your side and on call. Representatives from Willis-Knighton Stroke Center are on hand to answer your questions, and they're going to be here until 7 o'clock. The number on your screen, 318-861-KTBS. Joining us now is the Willis-Knighton Stroke Coordinator, Brittany Anderson. So, Brittany, most important question, what are the signs and symptoms of a stroke?
So, in the stroke world, we use the acronym BFAST to help us learn all the stroke symptoms. B stands for balance. We're looking for someone who may be off balance or dizzy or leaning to one side. The E stands for eyes. We're looking for someone with vision loss, blurry vision, or their eyes won't track completely side to side. F stands for facial droop. That one is one of the classic signs of stroke that most people are aware of. One side of your face starts to droop. People think that maybe the other side is drawing up, but really it's one side drooping. A stands for arms. Arm weakness that can either be a little bit of a drift or hits the bed and be completely paralyzed. S stands for speech. Speech can be slurred speech, it can be saying the wrong words, or it can just be some confusion. And T stands for time, and time is one of the most important things for all of these. We want someone to get to the emergency room quickly. We have about 2 treatments for stroke, and they're both very time dependent.
Okay, great information there. And again, those phone lines are open until 7 o'clock. The number is 318-861-KTBS, and we'll be right back.
Welcome back, everyone. The month of May is Stroke Awareness Month, and tonight KTBS 3 is on your side and on call. We have medical representatives from Willis-Knighton Stroke Center here in our studio tonight to answer your questions up until the top of the hour at 7 o'clock tonight. The number to call, 318-861-KTBS. Don't worry about calling us in the middle of the newscast. We actually want to hear the phones ring. That's what's important. Joining us right now tonight is Willis-Knighton Stroke Coordinator Cheryl Adair. Cheryl, thanks so much for joining us here tonight. Obviously, the month of May is something that you guys want to get the word out about how important stroke really is and what this, what the symptoms are, what the signs are. If someone may be experiencing stroke, what are some of the things that they need to be aware of?
They need to be aware of that the signs and symptoms can be really big or even really small. We discussed that several times, that it can be a very mild symptom. And of course, the BFAST that Brittany talked about earlier in the show. Be aware of changes in your body, listen to it, pay attention to it, and seek help immediately. Call 911. It's better for them to tell you everything is okay than you ignore it and it'd be 10 times worse when we could have treated it.
When you get patients in and they have questions and you're treating them, what are some of the most common things that you hear from some of those patients about things that they may not have known, or maybe something that was very simple that turned into something bigger?
It can be anything from a mild headache. Well, I just had a headache. I'm just going to take some medicine. Or I just feel tired and weak. I'm a little dizzy. I'm going to go lay down and take a nap. And that's one of the worst things you can possibly do. You need to go seek help. You may think it's not a big deal, but if it's something new to you and it has changed, and if you have risk factors for having a stroke, you need to get them checked out.
How often should someone get checked out for a stroke? Is it one of those things where you got to keep, is it a yearly maintenance thing, or is it just when you feel that you may have the symptoms?
So people have modifiable risk factors, which is your diet and exercise. Maintain that blood pressure. You don't want to deal with high blood pressure. Keep your diabetes under control. All those things can be controlled to prevent you from having a stroke, and that of course takes the care of a doctor that you see on a regular basis to do those medicines and help guide you. The things we can't control are our age, our genetics, our family history, and what we're predisposed to having. But knowing that and having a doctor being involved makes a big difference as well too. But get it checked out, keep it monitored, and go at it. So.
Yeah, definitely can't go wrong with just getting it checked out. Listen to your body indeed.
Yes.
Again, don't forget the phone lines open until 7 o'clock tonight. The number 318-861-KTBS. Cheryl, thanks so much for joining us tonight.
May is Stroke Awareness Month, and we are on your side and on call. Representatives from Willis-Knighton Stroke Center are on hand right now to answer your questions, our questions, until 7 o'clock tonight. The number to call right there on your screen, 318-861-KTBS. And joining me now is a speech therapist, Elizabeth Walden. Welcome.
Thank you.
When we talk about stroke, one of the things that can be impacted is speech. Tell me how that all happens, and how do you help people regain their ability to speak if they lose it?
Absolutely. So as a speech therapist, what I do is I go in and I evaluate the patient. We have to look at their auditory comprehension. We have to look at whether or not they can answer yes/no questions, what they're understanding, how they interact with their family, how they interact with the doctors. And then we also evaluate their speech. In a way, are they dysarthric, meaning is their speech slurred? Have they suffered from a facial droop? How is that impacting their ability to speak? And also, how is it impacting their ability to comprehend what I'm saying to them? So what we do as speech therapists is we go in and we evaluate that, and then we start an intervention plan right away.
Now, when you have a stroke, you can even lose your ability to swallow. That sounds even more serious.
That is very serious because you're already in the hospital and we're trying to give you medications and you have to be able to swallow them. If not swallow them, an alternate needs to be decided. So we have to decide on what consistency. If they have a facial droop, do they pocket food, and are they at risk for choking? Choking is a really big issue once patients have had a stroke.
And so it's just really important that they get them to you, get their loved one to you guys right away so that you all can begin providing this special kind of care that they they need, obviously.
Yes, ma'am, absolutely. When in doubt, seek medical attention. It's better to go to the hospital and be told you have not had a stroke than to not go and suffer the consequences.
All right, thank you so very much
Sure.
for joining us. And
Thank
again,
you.
those phone lines are open a little bit longer. We got 15 more minutes.